And for this week's Health Freedom Report, we are joined by Heather Fazio. She's the Director of Texans for Responsible Marijuana Policy here in the great state of Texas. And we're going to chat to her about cannabis reform and the latest and greatest and activism here in Texas. Thanks for joining us, Heather. How are you?
I'm doing great. Thank you for the opportunity to be here. Good to see you, John.
Cool. Why don't you start by just telling us how you got involved in cannabis reform? What inspired you to take part?
Well, at the time, I was involved with an organization that we both hold dear to our hearts, Texans for Accountable Government, which worked on building broad coalitions based on single issues and really focusing on community values that help to bring our neighbors together. And now more than ever, that is incredibly important considering how politically polarized we are. And in 2012, when I was executive director of TAG, I started working with Texas Normal. I've been a supporter of the work that they were doing, and I started working with them in kind of a consulting and advisory capacity and helping them with getting into the Capitol and communicating with lawmakers about the ills of prohibition and how there's a better way forward. From there, I was recruited by the Marijuana Policy Project in 2013 while working for the Libertarian Party of Texas, and started full-time on marijuana policy in the spring of 2014, where we went on to build Texans for Responsible Marijuana Policy, a broad coalition of organizations working to advance sensible and compassionate marijuana policies.
Cool. Yeah, I was checking out your website. What's the URL, if you could share with us?
TexasMarijuanaPolicy.org, where you can find more information about the organization we're working with, our coalition partners that span the political spectrum, and our priority policies that include reduced penalties for low-level possession and bringing patients safe and legal access to medical cannabis.
Cool. Yeah, I checked out the website. I was pretty impressed with the number of coalition partners from a diverse background. Do you want to share with us what you think the importance of having these transpartisan coalitions is, and maybe share some of the partners that you're excited about?
Yeah. Well, we're obviously grateful to be working with the folks who have been active on this issue for many years. All of our great normal chapters, Marijuana Policy Project, groups like the ACLU of Texas, but also bringing into the fold more conservative organizations like the Republican Liberty Caucus, the 10th Amendment Center, which is a states' rights organization. We're working with the Young Republican Federation of Texas, very conservative young people who know that this policy is something that can unite people in Texas and is the right political move when it comes to conservative values. So we're thrilled to see all of these people coming together on an issue upon which they agree. In this case, marijuana is bringing people together. It's really a beautiful thing.
Cool. Yeah, it brings people together in more ways than one. Tell us, mentioned the 10th Amendment Center, and it seems like the federal prohibition on cannabis is obviously a violation of the 10th Amendment, which states that those powers not delegated to the federal government should be left to the states and the people, respectively. Tell us about this States Act. Is that what it's called? I understand there's something that could potentially be passed through Congress that would give more power to the states in this regard.
Well, we've seen increasing pieces of legislation introduced at the federal level and, of course, in all the states throughout our country. At the federal level, though, where the success has been is amending the budget in depriving the Department of Justice of access to resources to enforce federal prohibition.
Nice.
And that's been enforced since 2014. It's been renewed in every budget, and we're grateful to see fewer raids happening. We're grateful to see more research happening finally, and it's because of that restriction. But what we really need is comprehensive legislation passed at the federal level that removes cannabis from the Controlled Substances Act, a place it never should have been to begin with, especially Schedule I alongside heroin. It's absurd. People know that it's absurd, and finally people are starting to catch up to that. We need to remove it from the Controlled Substances Act and allow states to decide how they want to enforce marijuana laws. We have so much more power when we decentralize, when we work within our own states to create policies that are in alignment with our own values. And that's what we'd like to see. The States Act is a great example of bipartisan legislation at the federal level that would do just that. It allows conservatives, whether or not they support cannabis at the state level or not, it allows them to take a states' rights approach, that there is no constitutional backing or authority for the federal government to prohibit a plant that is objectively safer than alcohol, tobacco, and many of the pharmaceutical drugs that the FDA regulates and are prescribed to patients every day. So we're looking forward to this new era of criminal justice reform in general. We've seen the signage of the First Step Act, which is wonderful, the Farm Bill, which for better or worse, there are a lot of ugly provisions included in that legislation, but within it, it legalized cannabis across the board with the exception of one cannabinoid, and that's THC. Of course, we have work to do considering the therapeutic value of that component of the plant, but we're seeing a really historic movement happening across the country, and Texas is no exception with our state level momentum for policy changes.
Cool. Well said. If you could point to one or just a couple of factors that you think are responsible for the big shift that we've been seeing in the past decade or so when it comes to people's perspective and view of cannabis, what do you think, what are the factors that have enabled such reform to take place all across the country?
Hands down, the number one factor from my perspective that's helped with moving this issue along is access to information. Access to the internet, access to dialogue with our neighbors like never before, whether they're around the corner or across the state, across the country, around the world. We're able to communicate effectively about the facts about prohibition, the facts about cannabis. And while it certainly isn't a substance that's safe for everyone all the time, it's important that we understand that the falsehoods that have been purveyed by our own government has been lying to us about the harms of this plant. And when it comes to access to medicine, for using cannabis for medicine, it is unconscionable that we have been depriving people of it for so long. And now we're at a point where people are seeing through. They're seeing the man behind the curtain. They're seeing the facts on this policy. They're communicating with people now more than ever, reaching out for support, and now being more emboldened than ever to share their personal stories, whether it's a loved one that's using cannabis or wants to use cannabis because it's helping someone in another state, or they have professional experience as an academic or as a former law enforcement, coming forward with the courage to share that experience with lawmakers and with their communities. And that's what's moving the ball forward, is the courage that people have now because they're better informed and they're better connected with their community.
Yeah, there's something that is especially frustrating for me, and I feel anger about it, and that's the government denying access to medicine. It seems just so much more egregious than, firearms rights or standing up against the IRS, for example, when it's just something that's completely natural and helps so many people. Let's switch focus here to Texas, which is your stomping grounds and where you are most active. What do you think is one of the biggest hurdles in the past for cannabis reform here in Texas? And what are the best talking points to speak with some of these conservative lawmakers? I understand the medical aspect of it is extremely important this year.
Well, one of the biggest hurdles is stigma and stereotype, and overcoming the misperceptions that a lot of legislators and other community members may have when it comes to thinking about cannabis and those who use cannabis. Typically when you see, the B-roll in a news story, you're seeing someone, lighting a bong in a park. And that, while that exists, most certainly, there are more people using cannabis that are everyday average Texans. And by them coming forward and communicating with lawmakers about their need for this medicine, or about how they have been done wrong by the justice system, the so-called justice system, that's enforcing prohibition, we're able to help to overcome that. So the professional efforts at the Capitol, the honest, true heart-to-heart stories that people are sharing with legislators is really making a huge difference to overcome that stigma and overcome that stereotype. A lot of folks, they just have been they've fallen victim to the propaganda that's been perpetuated by our own government, the reefer madness era nonsense that's gone on for decades, and people have grown up in that. It's become ingrained in them. And we have to help to overcome that by opening their hearts so they can open their minds on this issue.
Yeah, I think it's a great example that makes me optimistic for the future prospects for liberty, that it was so much easier to propagandize and to program previous generations when the only source of information they had was the local newspaper or the local news report on the radio or television. But nowadays we have access to so much information, so much credible scientific research, that it makes it a lot harder to pull the cover over the eyes of the public, which is great. And I also appreciate how so many people are seeing through the veil of legitimacy that government purports to have with this issue, because it's so obvious that cannabis is not unsafe. It doesn't harm people. In fact, it really helps and benefits so many different people. Will you get us up to speed on the legislation that's on the table in the state of Texas?
Sure. Well, we have two priorities. One is reducing penalties for low-level possession, stopping the bleeding when it comes to prohibition. Texas arrests between 60 and 70,000 people annually for the simple possession of marijuana. Not trafficking, not distribution, but the simple possession of this plant. In 2017 alone, it was 66,000 people. And according to DPS numbers, 2/3 of them were finally convicted of a criminal penalty of a drug offense. And that means that not only were they arrested and facing 6 months in jail, $2,000 in fines, but 2/3 of them, it was over 41,000 people in 2017 that ended up with a permanent criminal record for a drug offense that comes along with lasting collateral consequences. A driver's license suspension for 6 months, the license to carry, your right to self-defense, suspended for 7 years in the state of Texas, not to mention hindered access to education, employment, housing, occupational licensing, which is a whole nother story, but still, all of these things are affected for a lifetime with a criminal drug conviction. And we're seeing year after year, tens of thousands of people falling victim to these poor policies. So we'd like to make a change by instituting, rather than criminal penalties, a simple citation. You pay your fee and you go along with your life. You don't end up with that lifelong criminal record. Chairman Moody, who's a former prosecutor from El Paso, has introduced a civil penalty bill the last 2 legislative sessions. This is our 3rd crack at it, where we've been building bipartisan support for this kind of policy. In fact, the governor came out in September during a live televised debate calling on the legislature to look into reducing penalties for low-level possession. The Republican Party of Texas included in their platform a plank that calls for a civil penalty. So we're seeing increased bipartisan momentum going into the legislative session, and I'm very optimistic about us being able to reduce penalties so we can eliminate those collateral consequences, as well as save valuable criminal justice resources. Shifting gears into the medical side of things on medical cannabis. In 2015, the legislature passed the Compassionate Use Act, which allows access to for those with intractable epilepsy to access to low THC cannabis. And while this program is unreasonably restrictive, it was historic in 2015. The legislature of Texas acknowledged that cannabis is in fact medicine, and they began licensing businesses and regulating the production of cannabis as they do with many other substances. And right now, just miles from me here in Austin, Texas, cannabis is being grown and being delivered to patients with intractable epilepsy. We've worked hard to make this program more inclusive and are looking forward to the opportunity we have in 2019, building on the momentum that we built in 2017, where more than half the House of Representatives signed on to legislation that would have added to the list of qualifying conditions, removed the arbitrary cap on THC, a very therapeutic component of the plant, and fix some of the fatal flaws with the compassionate use program that don't protect doctors. We need to see those changed, and we also need to see independent laboratories allowed for consumer protection. We in Texas taxes and regulation are bad words in Texas, and I'm a Texas girl. There need to be reasonable regulations in place. That's understandable, but there's room for the market to self-regulate, and that comes with independent third-party testing, offering accountability for consumers when it comes to the products that are on the market.
Wow. Okay. It seems like the civil penalty bill might be a low-hanging fruit that has real chance of passage. And, as a philosophical and practical anarchist, it's like, gives me a little tension in my stomach, but I do understand that we need to, when it comes to legislation and lobbying, we need to think practically. And that seems like a low-hanging fruit that would enable a lot of the conservative lawmakers to save face and not just willy-nilly say that cannabis is okay for anyone to consume. But I think practically speaking as well, it would really help a lot, especially poor, underprivileged, marginalized communities, African Americans and minority groups who are disproportionately targeted by law enforcement and get put into the system. And it just has sometimes generational effects that are really hard to undo. So I think that would definitely help marginalized communities especially. And that would be great to see something like that passed. On the medical front, do you think there's a chance that one of the compromises would be just to add THC as acceptable instead of just the CBD and very low amounts of THC? Or do you think maybe the route would be to add more conditions to the list of approved conditions? And also, do you think there's a possibility that just full-on medical could come to life here in Texas?
Well, there certainly is a great chance that a full medical program that puts Texas on par with the now 33 states
Wow.
that allow safe and legal access to cannabis, there's a great chance of that passing. As I mentioned, more than half of the Texas House, 78 members, including 31 Republicans, strong bipartisan support in the House, signed on to the bill, not just promising to vote for it, but signed their name to legislation that would put Texas on par with the other states. So we're going to carry that momentum into the legislature and, of course, push for that kind of medical cannabis program. But there are going to be, and already are, other proposals that would do a little bit less. And we're going to push for more and try to bring Texas along to catch up with, what's not new. This has been decades of medical cannabis being available to Americans in other states. More than half of Americans, I think it's actually close to 70% of Americans now live in a state where they have access to medical cannabis if they have a debilitating medical condition.
Wow.
And so we're looking forward to pushing hard for that. But there are other proposals that will just add a few qualifying conditions or that would ignore the lifting of the cap of THC. And that's where we come in. THC has been made into this boogeyman for some reason when we know that many medications have psychoactive effects on patients. And that's why we have labels on the bottles. We make sure that patients are consulted with their doctors and medical professionals so they understand the side effects that these medications can have. We trust them and they have a responsibility to not operate heavy machinery and drive under the influence. All of these things are already happening with other medications that are far more dangerous and addictive. And cannabis, including THC, should not be an exception. So we have to overcome that misinformation that they have, somehow compartmentalizing the psychoactivity of cannabis with the psychoactivity of, Xanax or opiates. We have to do that, and we have to also demonstrate the therapeutic value of THC. One study that I always bring to legislators relates to Alzheimer's, and a report that was issued out of the Salk Institute right here in the United States that showed that not only does cannabis help, including THC specifically, it mentioned in the report, stop the progression of the disease, it actually starts breaking up the plaque in the brain and reversing the effects of Alzheimer's, something that no pharmaceutical drug on the market can do. That is the value of THC. In addition to helping more people with seizures than CBD can offer, helping people with chronic pain. PTSD is an anxiety disorder. For many people, it's THC that helps them to get through the night without night terrors. These are real lives that can be positively affected by allowing them to access the whole cannabis plant, working with their doctors to determine which cannabinoids, which terpenes, which strains of cannabis are going to be the best for their medical condition and for their biochemistry.
Yeah, not to mention the cannabinoids are synergistic with one another. So THC enhances the CBD's effects and vice versa. Really, there's no reason not to have them all and to be so specific, but I guess lawmakers want to save face. Tell us a little bit about the other side of the issue. I saw the broad-based coalition you have on your website. Obviously, the patients, recreational marijuana users want to see this stuff get through. Who is on the opposite side? Big Pharma, the prisons, who's lobbying against this legislation?
Well, you know, in Texas, there's actually very little vocal opposition to what we're doing. It's mostly isolated to the Sheriff's Association of Texas. They've been the only opponents showing up at our hearings for our legislation. And, you know, in 2015, not only did they sign up against the bills, but they testified against them. In 2017, they signed up against them, but didn't testify. And I'm hoping the trend continues, and they just don't show up at all because they finally realized that not only do the people of Texas want to see these laws changed, but they'd have more resources and time availability to actually go after victims, or go after justice for victims of real crime.
Yeah.
So, you know, law enforcement, it's a cultural thing for them. Also, they don't want to give up their ability to search someone's vehicle for the smell of marijuana. Apparently, it's very significant in their ability to apprehend people for bigger crimes. You know, my position on that is there's a lot of real police work that could be done to apprehend, perpetrators and suspects in other crimes, rather than by chance you smell marijuana in their car, and how many people's rights are being violated in order for you to achieve that. There's a cost benefit that we really have to reevaluate here. And we have to have that honest conversation with law enforcement. But law enforcement really seems to be the only opposition, and isolated to that one association. We saw CLEAT, the Combined Law Enforcement Association of Texas, just on live TV recently, talking about how they have better things to do with their time, not only on the streets as law enforcement officers, but also as far as lobbying at the Capitol. They're not going to be coming out in opposition to this legislation, which is really heartening to hear. So other folks that, you know, may be opposed to it, often it's just because they haven't heard enough compelling arguments yet. It has only been a few sessions that there have been professional efforts at the Capitol to sit down and have an adult conversation about marijuana policy. People have been rallying against prohibition for decades, and now we're to the point where we're actually having honest conversations, sitting down at the Capitol, talking about how these policies are negatively affecting individuals, families, communities, and our country as a whole. And thankfully, legislators are getting on board because of these effective arguments that people are making about the cost to our justice system, the deprivation of justice to victims of real crime, the deprivation of access to medicines for patients that have seriously debilitating conditions. It's all happening, and it's going to happen at an accelerated rate, not only in Texas, but across the country, as more people feel empowered to talk about this issue with their friends, family, neighbors, and their legislators.
Heck yeah. Cool. It's good to see the tide is turning, and I think it'll give the legislators a healthy backstop for there to be such little opposition and so many people that are proponents of the legislation. All right, before we let you go, tell us what needs to get done in order for this legislation to get passed, and how can people participate?
Mm-hmm. Well, maybe the most important thing you can do is identify your legislators, where they stand on policy, and connect with them about how you feel about this issue. On our website, we have voting records for legislators, so you can identify who they are, where they stand, which based on their voting records or surveys that they've filled out during our election cycles through our voter guide. And then contacting them. Make sure they know who you are. If you're not super confident in going into it, we make it easy by having automatically populated letters that you can send in. But as you educate yourself more and feel more confident, share those personal stories about your neighbor or your loved one who's using cannabis, or about how your nephew got his student loans withdrawn or his grants withdrawn because of a conviction for a small amount of marijuana. That the law is causing far more harm than the actual plant ever could. Those kinds of personal anecdotes are really helpful in moving forward. In addition to that, we need support and those who can make financial commitments to the lobbying work that we're doing. We know that there's a lot of money in politics, and people that are at the Capitol are there for a specific reason, and we need to empower our lobbyists and our advocates to give them the tools that they need to be there day in, day out during the legislative session to ensure that this issue is on the forefront of the minds of legislators, that this is a priority during the 2019 legislative session. Because if we are not successful this spring, we do not have another shot at this until 2021. And so many patients do not have that time to wait. We have to take action now. The legislative session begins on January 8th, and if you can, contact your legislators before then. You can do so at our website, texasmarijuanapolicy.org, where you'll see legislator voting records on the top tab, and that's going to get you started on your path to advocating for sensible and compassionate marijuana policies in Texas.
Excellent. All right. Thank you so much for the work that you're doing in this area, and thanks for joining us on the Health Freedom Report.
Thank you, John.